Hello again, Dr. Thom Bober, All Well Holistic Healthcare. In our previous segment, we discussed the Category 1 blocking procedure as a way of reducing the torquing or tension along the spine, thus bringing the nervous system closer to 100% function. Oftentimes, people have waited so long that the body's ability to compensate for the stress in their system has actually degenerated to the next level. Now when that occurs, again, here's our brain and our spinal cord. We discussed how in a Category 1 model, a twisting or torsion occurs that the body has to compensate for. When we move beyond the level of compensation that the body is able to provide, the integrity of the pelvis begins to become compromised. So here we have the sacrum and the two ilia. Those are the bones here and the triangular bone right here in the middle. The recurrent twisting and torquing of the spine in response to accumulated stress now begins to concentrate on the ligaments holding these joints together. Here I can show you right on the spine what I'm talking about, the sacrum and the ilia, and the ligaments that hold these joints together become compromised and are unable to maintain the stability within the pelvis. When that occurs, there's a great deal of inflammation that begins to accumulate in the ligaments of these joints. Now understand that the nerves providing information to your legs pass very near to those joints. So naturally the inflammation that accumulates in that area will begin to affect the way that information is transferred along these nerves. Now when this occurs, very often people will express pain in their back, in their buttocks, and sometimes along the nerve pattern into the leg, very often along the front or the side of the leg. Our goal here then is to remove as much of the tension created within those sacroiliac joints and provide some amount of stability. We often recommend the use of a sacroiliac belt and icing right on the joint, along with various levels of cold laser to reduce inflammation and help the healing process move forward. So this is what we would call the Category 2 procedure, and it is the most common presentation that we see in our office. By the time this level of deterioration has occurred, people will be expressing some very painful and acute symptoms right along their spine or in their low back or in their hips. And at that point, in their minds, it makes sense to seek a chiropractic intervention. So I hope that clears up the Category 2 procedure and how it is that we use the blocks to put some stability back into the pelvis. Thanks.